And so I think that, one of the other things that's maybe a subject that's near and dear to my heart has to do with bladder and bladder health, which I think will round out the show nicely, and then we'll finish up the show with phone calls from our listeners, which is, I think, our favorite part, so we can reach out to you. And we're actually joined today on air by a true giant in the field. He's a close friend and colleague of Dr. Lepore's. So I'm sure we'll hear some good stories from years past and AUA's years past. And really the next 30 minutes or so, we're going to talk about basically fighting the weak bladder and bladder health. So I'd like to welcome Dr. Gary Leach to Dr. Radio. Dr. Leach is the director of the Center of Continence at Tower Urology at Cedars-Sinai Medical Center. He's the former chief of the urology department and director of urodynamics laboratory at Kaiser LA Medical Center, past president of the LA Urologic Society and the Urodynamics Society. So thank you for joining us, and welcome to Dr. Radio.
Thank you, Ben, for having me.
So we have sort of the 30-minute segment set up for the weak bladder, or sort of finding the weak bladder, fighting the weak bladder. I guess in terms of starting, is this something that a lot of our listeners do a lot of our listeners have bladder problems? We got the men's health show, but we certainly have some women listening. We got some old patients, some young patients. How common are bladder problems in the population?
It's thought, Ben, that up to 18% of men have significant bladder problems of some type, and even a higher percentage of women, up to 30% of women, at various times in their lives.
And what are some of the common problems, I guess, when we talk about weak bladders? Or I have patients all the time come in and say, my son told me I had a weak bladder, or my doctor told me I had a weak bladder. What are some of the diseases or some of the sort of complaints patients may have? And maybe it sounds like there may be some that are probably male-specific, but as Dr. Lepore knows, I always like to bring a little bit of female urology into the men's health show. What are some of the conditions that men and women may have?
Sure. Well, in men, a lot of the bladder problems are related to growth of the prostate with aging. And as your listeners probably know, when men urinate, the urine comes through the middle part of the prostate, and as the prostate grows, as they get older, it tends to pinch off the channel. And the result of that could be what people generically refer to as a weak bladder. Interestingly, a weak bladder could refer to what we as physicians call overactive bladder, meaning that when someone feels the urge to urinate, they have to rush to get to the bathroom right away. Otherwise, they may have an accident, or they're getting up 4 or 5 times at night to urinate and are totally exhausted because they can't sleep. So someone might refer to that overactive bladder symptoms as a quote-unquote weak bladder. And the other sort of category in men is men that have a significant blockage for the prostate, and as time goes on, the bladder muscle does in fact become weak, and they have more and more difficulty emptying the bladder. And these men may have symptoms of recurrent urinary tract infections, constantly running to the bathroom because they never empty their bladder well, and maybe bladder control issues because the bladder may just tend to overflow and constantly dribble, which can be a big problem. But the good news is that there is appropriate testing available to sort these problems out in men and in women to direct therapy that generally can be very successful.
It's amazing. I guess I'm very lucky to be sort of practicing now or exclusively now as opposed to years past when we really didn't have a whole lot of therapies to treat these men or women for that matter. We're running a little short on time. I wanted to sort of, I guess, move ahead in terms of if you give us sort of the tips for our listeners out there, any do's and don'ts for the bladder. Should we be drinking more water, less water, cups of coffee, any dietary supplements, any exercises that we should be doing?
Well, dietary issues certainly can be important. I see a lot of men that drink a lot of coffee, tea, and alcohol, and they wonder why they're rushing to the bathroom every hour, or wonder why they're getting up, 6 times a night if they had 2 martinis after dinner. So just being aware of those issues can be important. And I think just globally, that if somebody's having symptoms that's affecting their quality of life, that they should see a qualified urologist and really have that evaluated, because it's not something that you have to live with. If the symptoms are from overactive bladder, there are treatments like urgent PC, which is like an acupuncture treatment, Botox, other treatments that can help that. As you mentioned, different treatments for bladder outlet obstruction, whether it's medications, potentially the urolift, standard surgical procedures. So there's a huge number of advances in how we treat this, but I think the biggest thing is for the man that's having symptoms to seek help and realize that if it's affecting their quality of life, that they don't have to live with it. Something can be done.
So all of our listeners out there, if you're having problems and you're in the LA area, please you'll visit Dr. Leach at the director of the Center for Continence at Tower Urology at Cedars-Sinai Medical. I'd like to thank you. It was absolutely a pleasure getting to talk with you. We'll have to have you back as our phone lines are ringing, which means we have tons of callers that are probably asking questions that we'll try to get to in the next half an hour. If you got callers out there, give us a call, 1-877-NYU-DOCS. That's 1-877-698-3627. We're going to take a break, but we'll be right back, so don't touch that dial.